Welcome back to the Ed Show. Are Democrats caving in on health care reform? Big question mark. I get email on this all the time. People are saying, Ed, the first show you did on MSNBC, you pulled out your health care bill. Don't let this die. Well, first Senator Baucus took single payer off the table. Now Senator Schumer is pushing a compromise where any public plan would, quote, adhere to private insurance rules. Now, I don't want to prejudge this thing, but wasn't it the whole point of a public option that it wouldn't follow the for-profit rules that have gotten us in such bad situations with health care costs going up and bigger monthly payments all the time? Now, if we don't want to push back on this, we know that big pharma and big insurance companies are going to be just taking us to the woodshed. Are Democrats giving away the store on this? What's this about a compromise? Joining me now is Robert Reich, former Secretary of Labor and Professor of Public Policy at UC Berkeley. His book, Super Capitalism, is available now in paperback. Mr. Reich, tell us, where are the Democrats going wrong on this?
Well, Ed, there are compromises and then there are compromises. There are compromises that are giving away the store. And I hope I am wrong when I say this, but it looks as though at least Senate Democrats are about to take that public option off the table. Now, remember, in President Obama's original idea was to have a system in which private insurers would still be able to compete for people's dollars, but there would be that public option that would keep the private insurers honest and also would be able to use its bargaining leverage to get low prices from drug companies. So that was very important. If you take that public option off the table, well, you have a variation on the present system.
Well, it's still going to be for profit, it sounds like to me. On the campaign trail, this was Vice President Biden talking about raising taxes when it comes to health care benefits. Here it is.
Let me tell you something you don't know about John McCain and Sarah Palin. They are proposing the largest increase on middle-class taxpayers in American history. John McCain, if I've misstated your position, if you're not going to tax health care benefits, please tell me. Please tell me.
Now, what about the Democrats? Are they now thinking about taxing this benefit? What do you hear?
Well, yeah, the Democrats are looking for ways to fund this new universal health care plan, Ed. And one of the places one of the few places where there's money left is in terms of actually taxing employer-provided health care, which is now free. Now, the Democrats are not saying tax all of it. The Democrats are now beginning to say, well, why not tax the employer-provided health care that the rich get free? And that would provide enough money to provide universal health care for everybody.
Mr. Reich, I've said this for a long time. There's a tsunami coming in small business in this country, and we know that next year more small businesses across the country are going to be eliminating the health care benefit as a benefit in the workplace. Now, with that, how can they take the public option off the table? Because it seems to me there's going to be a heck of a lot more people that are going to want to go into that.
Yeah, look at the insurance companies, Big Pharma. They are putting enormous pressure right now on Congress, on the Senate. They're big campaign contributors. It is very important that people understand that that public option is the centerpiece of the entire plan. If it's taken off the table, there is just not going to be any real cost saving. There's not going to be really any opportunity for average Americans to get good deals with regard to health care.
And what about, I got to ask you this, being the former labor secretary, here we are at 100 days since the stimulus package has been passed. What's the report card in your opinion?
Well, I would say I would give it a kind of a B-. Much of that stimulus plan has really not taken effect yet. We already knew that it would take a time. About 20% of it is out there. It is starting to work. It's starting to turn the economy around a little bit. It's like a time-release cold capsule. Much of it is going to be released over the next 6 months, and I think that's a good thing. Everybody knew that it was going to take some time.
Well, I think the country's looking for some instant relief, but I agree with you. It's in the B area. I don't think they've gotten the money out fast enough. Mr. Reich, thanks so much for joining us tonight.
Thanks, Ed.
Next on the end.